for some time. But for some groups, 2 doses may not be enough to achieve a high level of protection, or immunity can decrease gradually over time, leaving them at higher risk for serious outcomes. That is why, beginning in August, Ontario became the first province to offer a 3rd dose to immune-compromised individuals and a booster for those at highest risk, including transplant patients, patients with cancer or active treatment, recipients of immunosuppressive medications, residents of long-term care homes, retirement homes, and First Nations elder care lodges, and seniors living in other congregate settings such as assisted living facilities, chronic care hospitals, and congregate seniors apartment buildings. In response to the latest evidence and guidance from the National Advisory Committee on Immunization, I am pleased to announce that the province will begin to offer booster doses of the COVID-19 vaccine to additional populations if at least 6 months have passed since their 2nd dose. These groups include those aged 70 and over, healthcare workers and designated essential caregivers in congregate settings, individuals who received 2 doses of the AstraZeneca vaccine or 1 dose of the Janssen vaccine, and First Nations, Inuit, and Métis adults and their non-Indigenous household members. These additional groups will benefit from a booster dose as they are at increased risk of waning immunity and greater risk of exposure, serious illness, and outcomes. Et en réponse aux plus récents éléments probants et au Conseil du Comité consultatif national de l'immunisation, je suis heureux d'annoncer que la province commencera l'administration des doses de rappel de vaccins contre la COVID-19 à d'autres groupes s'il s'est écoulé 6 mois
if
au
it's
moins
been
depuis
at
la
least
deuxième
6
dose.
months since their
Ces
second
groupes
dose,
additionnels bénéficieront
additional group
d'une dose de
will
rappel
benefit from
puisqu'ils
a
courent
booster
des risques
because
accrus
they are at
d'une
greater
immunité
risk to
affaiblie
see their
et de plus grands
immunization
risques d'exposition
decrease and
de
are
maladies
at
et
greater
de
risk
résultats
to
graves pour la
being
santé.
exposed to diseases.
Starting on Saturday, November 6th at 8 a.m., eligible individuals will be able to book their booster dose appointment through the COVID-19 vaccination portal or by calling the Provincial Vaccine Contact Center, directly through public health units that use their own booking systems, and through Indigenous-led vaccination clinics, select pharmacies, and primary care settings. Hospital-based healthcare workers are encouraged to reach out to their hospital employer to get vaccinated through their hospital vaccination program. In addition, Ontario is supporting northern and remote fly-in First Nation communities by launching Operation Remote Immunity 3.0 to administer booster doses in those communities with transportation and vaccine supply assistance from Orange and local public health units. While a primary series of the COVID-19 vaccines has shown to maintain high vaccine effectiveness and to provide powerful and persistent protection following the 2nd dose, the province is planning to expand eligibility for a booster dose to all Ontarians aged 12 and over in the coming months. Emerging evidence suggests vaccine effectiveness against asymptomatic infection in mild illness may decrease over time, and a booster dose could help to restore and maintain protection against infection. Either mRNA COVID-19 vaccine may be used as a booster dose, regardless of which COVID-19 vaccine was used in the primary series. And studies suggest that a booster dose of an mRNA vaccine produces a very good immune response that is generally higher than the immune response after the primary series. It has a favorable safety profile and provides good short-term protection against infection. While Ontarians continue to expand its eligibility for booster doses, our urgent priority and call to arms remains for those who have yet to get their first dose or complete their primary series. Alors que l'Ontario continue d'augmenter
Ontario
l'admissibilité
keeps
aux
increasing
doses de
eligibility
rappel,
to
les
boosters,
personnes qui n'ont pas encore reçu la
people who
première
still
dose ou
haven't
qui n'ont pas
received their first
terminé la
dose
série
or
primaire
have not gotten
demeure
both
notre
doses
priorité
are our
la
priority.
plus urgente. The majority of hospitalizations are amongst the unvaccinated, which is why I continue to encourage everyone to get fully vaccinated, as it remains our best defense against COVID-19 and its severe outcomes. It's also important to remember that while COVID-19 vaccines are an important tool in our toolbox against this pandemic, we all need to continue with the key public health strategies that have been effective in keeping this pandemic under control in Ontario. This includes staying home when sick, getting tested if you have symptoms compatible with COVID-19, hand hygiene, masking, and getting also your influenza vaccination. Thank you. Merci.
We'll go to the floor for questions. Just a reminder, one question, one follow-up.
Dr. Moore, how many people are still unvaccinated in Ontario?
At present, we have overall population coverage rate of around 77.4. So if you multiply that by our 14.7 million, you'll have the uncovered. So roughly a quarter of Ontarians have yet to be protected. Under 11 are not eligible, obviously. So we still have a ways to go to reach population protection. We need either Ontarians to get protection through vaccination, which is my preference, or they will get protection through natural exposure. My preference, obviously, and I hope all Ontarians, is to get protected through immunization. That is our way out of this pandemic.
In terms of the boosters, at some points in the technical briefing this morning, there were a lot of numbers coming at us. How big are these boosters compared to the original shots? Like, are they half a dose? Are they a full dose? Does it differ from Moderna to Pfizer? And what about people who got AstraZeneca and then an mRNA? I'm assuming they have to wait.
That's correct. So number one, at a population level, we still, 5 to 7 months out after our second doses, have very good prolonged protection for all Ontarians. The data is showing very good protection against severe outcomes or hospitalization. In terms of the third dose, it's a little complicated in that if you're 70 and over, we'll offer you either the normal dose of Pfizer, which is 30 micrograms, and or the full 100 micrograms of the Moderna dose. So that is for the 70 and over population. For 70 and under, it's the normal full dose of Pfizer, 30 micrograms, or a 50 microgram booster dose of Moderna. We have found through the studies that NACI has evaluated and our Ontario committee that the 50 microgram dose is a very good booster in the general population of healthcare workers and has the same benefit and safety profile. But in the older population that has waning immunity, we felt it best to continue and agree with NACI that the 100 microgram dose is the best dose in that population.
Dr. Moore, when the COVID-19 vaccine or the general public is eligible for a third dose, I think there would be a bit of anxiety as to whether or not the second dose would be the gold standard or the third dose would be the gold standard in terms of, having access to or being exempted from any restrictions. Where do you stand on that? Would the third dose be something that you would want everyone to receive, and should restrictions be based on that?
Well, we are offering and suggesting that when it becomes available, that all Ontarians consider taking the third dose, especially if you're vulnerable to this virus. And in particular, that'll be anyone immune suppressed, anyone 70 and older, or anyone with any chronic underlying medical illness. At present, though, because we are finding that at 5 to 7 months out after the second dose, we still, at a population level, have good, profound and persistent protection, we are not mandating any change in the validation or certification process within Ontario. So 2 doses will be acceptable to be able to get you into any of the venues that currently have any restrictions on them for vaccine certification validation.
Well, you also say, you talk about protection against COVID-19, and you can receive it one of 2 ways, through immunization or through contracting COVID-19. What kind of a message do you think that sends to those who are vaccine hesitant or vaccine resistant that, you could perhaps, like the chicken pox, go and contract it from somebody rather than go and get the actual shot?
Yeah, I just think it's very appropriate that everyone realize that this virus isn't going away, that this virus is going to be persistent and most likely will become an annual winter virus, as in the other coronaviruses that exist in Ontario and Canada and that affect humans. So that really there is no escaping this virus. You either are going to get it naturally through exposure, and given that it can have such serious and significant outcomes associated with it, that is absolutely not our preference. Our preference is that you use the safe and effective vaccines to protect yourself, your community, your loved ones, and that will have the least impact on you as an individual, but also on our health system, and help us recover much more quickly as a community, as a population, by having the highest immunization rate we can achieve as a province.
You mentioned.
I'm sorry, Alex, are you going to coordinate these or?
No, it's a free
No?
for all.
Oh, okay.
Unfortunately, here in the media studio. Thank you.
Dr. Moore, you mentioned 5 to 7 months still showing strong immunity towards COVID-19. Is there a date that you're aware of where immunity really drops off? What would your message be?
So there is no sudden drop-off that we've seen in any of our data. We do see a slow and gradual waning in immunity in those specific populations that we've already addressed. So we've had a very robust data-driven strategy, starting in our long-term care facilities, then moving on to those that require that third dose for their primary series, so those that are undergoing chemotherapy or transplant surgeries, and others that are immune suppressed. So we have seen slow and gradual fading immunity in some populations. In the general population, we're not seeing that at present, and hence I think we have time to reflect on the best science and the best timelines by which we then provide third doses at a population level.
Do you foresee a time in the future where 3 doses would then qualify you as fully vaccinated?
Yeah, I can see that down the road. We'll always be data-driven and following the data in a long-term effect. So we do have great researchers in Ontario at the Institute for Clinical Evaluative Studies that are monitoring the immune response at a population level, and I receive data on a monthly basis. There's been recent publications out of Quebec and British Columbia on the profound and persistent protection at a population level 5 to 7 months out. So we're tracking this, and based on our tracking of the immune protection at a population level, we'll make decisions together with NACI of when the third dose would be offered. It may be that 3 doses could provide long-term immunity at a population level against this virus, but we'll follow the data and ensure Ontarians are best protected by continuing to monitor this seroprevalence and immune protection data.
Dr. Moore, the Ontarians were told to take the first vaccine available to them. So can you explain why those who took AstraZeneca are among those considered high risk and in need of a booster shot?
Yeah, so very good question. The immune data that we're following is showing that 2 doses of AstraZeneca still has a significant protection against hospitalization and severe outcomes, but it is less than the mRNA by around 10-15 percentage points on levels of protection. And as a result, and now knowing that we get a profound second boost from a subsequent mRNA after 2 AstraZenecas, it is our advice to provide the mRNA vaccine after those 2 to boost you back to a higher level than that which you would have had with 2 AstraZenecas alone. It seems that data will inform our immunization strategy and best protect Ontarians that have come forward with those 2 doses of AstraZeneca.
Is it difficult to convince people to get a third dose when you're having so much difficulty convincing a portion of healthcare workers, for instance, to get a first dose?
At 88.2%, I'm so thankful to Ontarians that have come forward and gotten their first dose. Of eligible people 12 and over, I think that's a remarkable statistic. It's one of the highest levels of vaccination in the world. I would love to see it higher. The vast majority of physicians have stepped forward and gotten vaccinated. It's in the high 90% level now through surveys through the College of Physicians and Surgeons of Ontario. So many healthcare workers are embracing protection of themselves, their family, but also of their patients. I think for healthcare workers, if you haven't been vaccinated, please, I think it's your professional duty to do so. You can carry this virus without having symptoms into your workplace. It's that 2 to 3 days before your symptoms start, which you are actually shedding a large amount of virus. It puts your patients who are immune suppressed potentially at risk, and I do think it's the professional duty of every healthcare worker to be immunized, and I call you forward to get immunized.
Dr. Moore, during the tech briefing, we heard more on the push for children 5 to 11. Can you just take us through how those decisions were made and how that rollout will likely work after Health Canada approves it?
Yeah, so we're waiting for Health Canada. They're reviewing the evidence that's been provided to them by the manufacturer. I was happy to see that in the United States, the CDC had voted unanimously to support the 5 to 11 vaccine. Once Health Canada has made a decision, the Ontario Immunization Advisory Committee will also review data, and the National Advisory Committee on Immunization. We would hope to align with our national counterparts to ensure the rollout is simultaneous across Canada for the 5 to 11 year age group, and be able to communicate the risks and benefits of vaccination in that age group. We anticipate that information coming to us this month, most likely near the end of this month, and have worked diligently with our health system partners to prepare a rollout of immunization for that population, which will include our public health units, our pediatricians, our pediatric hospitals, our pharmacists, and our primary care providers.
Dr. Moore, could I ask you about that, just that issue about child vaccines? There's polling data that definitely suggests that parents, even those who have been vaccinated themselves, are more likely to be hesitant, particularly with young children. What would you say to a parent who's on the fence about vaccinating, say, a 5 or 6-year-old?
Well, I haven't seen the data yet, so I want to see the data. I want to review it and ensure that the safety and efficacy is there, and then review it with the Ontario Immunization Advisory Committee and NACI. We also have pediatric experts to help support our strategy within Ontario that we will consult with. So I don't want to get ahead of the data, but once that's reviewed and we have a strategy, we will ensure that we can have these conversations with parents, that we can answer their questions, any concerns that they have, and have a robust, transparent, accountable communication strategy with the public regarding this. I can understand as a parent that you'd want to ensure that you understand the safety and the efficacy and the risks and the benefits of immunization in that age group, but I won't get ahead of the data because I haven't seen it.
Dr. Moore, I don't think that boosters for the general population was part of NACI's recommendations, correct me if I'm wrong, but why is that part of Ontario's strategy, even if it's looking forward to 2022? Well,
I think we wanted to signal that third doses will be part of a provincial strategy, that we know, because many of our scientists are on the NACI committee, that this is part of our overarching Canadian strategy, and that we should be transparent with the Canadian and Ontarian population that we will have a third dose strategy, but we're monitoring the data. Both in Ontario and in Canada. It will be informed by that data, and the dose interval will only be put in play when we understand if there's waning or fading immunity at a population level, which we're not seeing just yet.
And I know we're talking 2022 for the third dose general rollout. Is this something you envision as us needing, say, 4th, 5th doses? Is it going to become sort of an annual flu shot type thing?
Well, great question. Never underestimate this virus. We're currently dealing with the Delta strain, and as we all realize, this virus wants to mutate. And if it continues to change and the vaccine effectiveness goes down at a population level, we would have to entertain providing an additional dose of vaccine, but probably based on a new or current circulating virus. So at present, we're monitoring the situation. We're following the strains that are in Ontario and Canada and internationally, and the vaccine manufacturers will be monitoring whether or how significantly the virus is changing and how effective the vaccines are. So at present, against Delta, these vaccines are very safe, very effective at preventing hospitalization and minimizing death and the impact on our intensive care unit settings. But if that changes and the virus changes, clearly we'd have to readdress our immunization strategy.
Thanks, everyone.
Have you made a decision on mandatory vaccines?
I believe that would be revealed by the